Yeah, good evening. Barbara, thank you for this kind invitation to give a small talk. I have only 10 minutes to introduce you in our research data, our research project about scleral cross-linking to treat progressive myopia, to inhibit the axial eye elongation in high myopia cases, to prevent the pathological consequences of this process. My name is M Francke. I'm from Germany, University Leipzig. I'm not a medical doctor and ophthalmologist. I'm a biologist, and I work since 20 years in retina pathology. And this is Ms. Joanna Stachnik, my colleague. She joined the project 2 years ago. And we do this research in cooperation with Professor Peter Wiedemann. Somebody knows him. He's the head of our ophthalmology department and performs these with his colleagues the animal experiments and in future maybe the application in humans. So let me start. You are absolutely familiar with high myopia and the pathological consequence of that. You see these that axial eye elongation causes the chorioretinal dystrophy. Here, these yellow patches, and this is in progress over the years, and the visual acuity or the visual field getting worse. Millions of people worldwide affected by these high myopia and the pathological consequences of that, especially in Asia, with a different genetic background. Yeah, the incidence is really high there. And the cause of this axial eye elongation is a biomechanically weak sclera, and that makes the eye bigger, driven by the intraocular pressure. And as a short reminder, the scleral tissue is a choroid, the retina, that is a histological section of a rabbit eye, light microscopy. The sclera consists of collagen fibers organized in bundles with different orientations, and that is very similar like in the cornea. Yeah? And that raised the idea that we adapt the keratoconus treatment, the corneal cross-linking, to the scleral cross-linking, because there are very high similarities in structure and biochemistry of this scleral and corneal tissue. And that was invented by Wollensack and Spörl and Seiler, and this cross-linking is invented in 2004. And we work together with Professor Spörl, and he's a physicist, and he makes biomechanical experiments. And shortly, introduction of the principle of collagen cross-linking. Riboflavin, vitamin B2, is irradiated by blue light or UV light, and that in turn leads to a production of reactive oxygen species, several kinds of oxygen species, and that in turn increase the numbers of chemical bridges between the collagen molecules and inside the extracellular matrix. Yeah, that is only a short introduction. We have only a few minutes to talk about that. We use the rabbit eye as an animal model to do that. We perform operations on young pigmented, young albino rabbits and adult ones, and we perform a lot of histological, immunohistochemical, electron microscopy examinations to determine the damage threshold after the irradiation with different levels of light energy, and that means we have characterized the damage threshold for this method. The second one is we have a kind of proof of principle. Riboflavin, blue light collagen cross-linking increase the biomechanical stiffness of scleral tissue. This is a diagram of viscoelastic measurements to characterize the biomechanical stiffness increase after the treatment. We have here the stress, that means the power to stress the scleral tissue, and that is the strain, that means the dimension of stretch. And we see the control, and the only riboflavin treatment is very similar. And we see here that the treated one, after scleral cross-linking, you need more power to stretch the scleral tissue. That means it is really stiffer. And another point, important point, is that we can regulate the stiffness by different light intensities. The more light, the more stiffer, up to, below the damage threshold. That's for sure. And another proof of concept is in the young animals, we can really inhibit by 10 milliwatt per square centimeter the eye growing. That means these are young rabbits and the eyes are still growing, and we can, after scleral cross-linking, inhibit the axial eye elongation. If we use only 3 milliwatt per square centimeter, nothing is happening compared to the control. And if we treat only with light or only with riboflavin, there is no difference between the control and the treated one. That means we can really inhibit eye growth or eye elongation. To summarize that, we have a proof of principle. We adapt the method of corneal cross-linking because the similarities between the cornea and the scleral is really obvious. We have the proof of principle. We can increase the scleral stiffness. We characterize the safety parameters in retinal histology. The damage threshold is 10-fold less than an effective blue light dose. We have a proof of concept that the riboflavin really inhibits eye growth. In the future work, we have to develop a substance application and irradiation system for an application in humans, because the images I presented was from the early stages with inconvenience adapters, and that is not really applicable to humans. And that means we have to develop a new medical device for that. We have to optimize the therapeutic approach. That means a light regime, light on, how many light intensity, which level, and so on. And we have to prepare all the requirements and regularities for a clinical trial to apply that in humans. That is what we develop with our industrial partner. This give you a small idea about how it might work in future. We have here such kind of spoon with which we can apply riboflavin, here the drops, and the same device can irradiate the light, and that we can introduce into the orbiter and the tenon capsule to treat the scleral tissue. And maybe this is one of the adapter. We developed totally new on various forms of adapters in various dimensions. We would like to get smaller and smaller to get more or less in minimal invasive therapy, but that gives you an idea how might it really work. We have different adapters for the 4 quadrants, and yeah, that's it. And we think in the next 2 or 3 years we can really realize a clinical study, because we are strongly believe that it really works. And not only in cases of high myopia, more or less in cases of staphyloma or in local extensions of sclera or a melting disease in so what. Okay, thank you very much for your attention.
Doctor, well, a question to both. This is great. This is actually what we were hoping to have. But which are the side effects of a therapy like that? I mean, if we are treating a collagen if we are treating the collagen, you tell me, can we damage the vessels? Can we damage other structures into the eye by doing the cross-linking?
Yeah, you're absolutely right, and that is what we have to care about it, to treat the blood vessels around the eyeball, and maybe we can touch with the applicator the nerves or the optic nerves around that, and maybe we can cross-link all this tissue around that, but we never saw such kind of side effects in our rabbit eyes. If we use minimum effective dose, we see nothing more than this inhibition of eye elongation. There is no haze of lens or glaucoma development or increase of to make it too stiff, and that cannot really respond of the changes of the intraocular pressure. We never see that kind of problems with that.
So with your research, you have to be able to find which is the molecule which has the disease, which is the target. What happens into a sclera of a high myops?
There is, nobody knows that exactly. Normally, the inventors or the science community think we really cross-link the collagen fibrils with these chemical bridges, these additional. But that is only one side of that. I believe the collagen fibers are responsible for the elastic properties. But this is viscoelastic, and viscosity depends on time, and myopia develops over years, and that means there is something wrong with the viscous elements, and the viscous elements are determined by the extracellular matrix. This elastin, aggregan, brevican, something like that, and the extracellular matrix is responsible for the arrangement of the bundles and the size of the fibrils, and maybe we are relatively sure that we cross-link additionally this extracellular matrix, more or less responsible for this myopic. That is a kind of fluid like honey. Yeah, that is myopia. That going though. It's not like a spring. Yeah, that's really the difference. We don't target an exact concrete molecule because we create by this method only reactive oxygen species, and they react with hydroxy, carboxy, NH groups from every amino acid they get in a nanometer range.
So not a single molecule, but a group of them.
But we see from the keratoconus, from the corneal treatment, it works. It really works, and you can operate that one, and it stays or maintained for several years, stable. That's really, really successful story.
Yeah. So one day we will actually be able to propose scleral cross-linking to when we see a patient with increasing myopia, we will be able to propose this kind of surgery.
Yeah,
it's not so far. I mean, in your research, you think it's not so far?
Yeah, we strongly believe that we can get the first experiments, if we get enough money for that research, in the next 2 years. Yeah, that is our. We would like to apply that for the first patients in Leipzig in the next 2 years. Yeah.
Well, ci sono domande? So how long does one treatment last?
Yeah, okay, we don't know that in humans. In our long-term experiments in rabbit, this inhibition effect after cross-linking maintained for more than 6 months. That is the longest time we examine. Yeah, but we believe it's maybe longer. It would be nice.
Volevi sapere quanto dura o un trattamento? No, one single procedure. How long is it?
Okay. At this time, all the results are published. Yeah, you can read that and in detail in the publications. We applied for one treatment 20 minutes, and that is really too long because we assume that you cannot only treat one quadrant. Of that point, you have first of all to treat the entire scleral area you can really reach without muscles and so on, and that would take time 1 hour. That is really too long, and that is then it's nominated as Bosco-Bunsen law. That means you increase the light level and so you can reduce the time at certain level. That means, okay, you double the light intensity and you use half the time. And that is exactly what I mean with that we have to do in future to optimize this application regime. We try to combine several applicators for the entire eye. Yeah? And that means not 4 times 20 minutes, it means one applicator in 20 minutes, and that might be realistic in future.
So congratulations, it
Yeah,
was a great talk.